will say a land acknowledgement first here before we start with the remainder of our agenda. In the spirit of our journey to promote reconciliation, we would like to honor the truth of the shared history and acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. We are grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. Okay. So you are allowed to ask some questions when we get to the Q&A session. We will, given that this is a webinar style, the option to speak will be a little bit different. We'll have to kind of manually allow you to speak, but please feel free to use the chat box or the Q&A, and we will make sure that if you have any questions, we are getting to those. You can also raise your hand and use some emojis if you wish while the panelists are speaking. And as I mentioned previously, we will record this session and share both the recording, the slides, and some reports following our time together today. And a brief agenda. So I will review some high-level goals of the project with each of you. And then we'll dive right into a panel discussion. So we'll introduce each of the panelists that are joining us today and ask some questions that really will help reveal the story of the work that they did over the full year of the project. We'll dive into a Q&A and have some discussion around that and answer any questions that you have. And if we find that we do run out of time, if there's some great discussion going on and we just can't answer everybody's questions, please know we will respond to those in our follow-up email. So we make sure everyone's interests and queries are getting responded to. And we'll do a final wrap-up and a survey we would love you to participate in to help us make sure that these events are meaningful for you and your valued time. Oh, I'm going to stop sharing. All right, so I'm going to introduce our panelists, and I'm going to start with Megan Hinks, who is joining us today from Calgary.
Hi there, thanks Marla. My name is Megan Hinks. I am the network coordinator for the Weigh-In Network here in Calgary, which is a collaboration of 4 agencies. So CARIA, Calgary Seniors Resource Society, JFSC, and Calgary Chinese Elderly Citizens Association. So they make up the network of the Weigh-In. And then as part of the partnership of the Weigh-In, we created the Aging and Community Supports Program, which was a part of this home supports pilot project in the province. And so our program provides case management and system navigation, and the outreach is provided in the client's homes and out in the community. So that's us.
Wonderful. Thanks, Megan. And I will turn to Terry Anderson to introduce herself.
Hi, I'm Terry Anderson. I work at the Golden Circle Senior Resource Center in Red Deer, Alberta. I'm the Senior Outreach Coordinator here. We have an outreach program that we deliver in-home non-medical supports to folks in our community. And part of this project was bringing it to the rural folks. We also are an activity center for the older folks in Red Deer, Alberta.
Thanks, Terry. And next up is Tatiana.
Hello, my name is Tatiana. I work for Jewish Family Services Edmonton. I'm older adult service program manager as of July 1st, and this is a new department that was created on July 1st this year. Last year, our outreach team worked with both seniors and younger individuals, and through our outreach program, we were involved in Aging and Community project, providing services, case management, connection to resources, advocacy and home support services to older adults 55 plus. And we continue doing this through other projects right now.
Thank you, Tatiana. And our final panelist is Krista.
Good afternoon, everyone. My name is Krista Mulberry. I am the Social Prescribing Project Manager with the Edmonton Seniors Coordinating Council. Something that came out of the learnings of aging in community and some of the work that is being used to build on the Aging in Community project through social prescribing. And so in partnership with Jewish Family Services Edmonton, Sage Seniors Association, the Multicultural Health Brokers, Edmonton Meals on Wheels, and Drive Happiness, we have our social prescribing project, which we'll talk a little bit more about.
Wonderful. Thanks, Krista. So I'm going to just give a brief overview, and then we'll dive into those questions that we want to chat about with everybody. So this project began April 1st, 2022, and ran for a full 12 months with some overarching goals amongst the 3 sites and with Healthy Aging Alberta. So think back when the pandemic was kind of in full swing. That's sort of the impetus behind the funding. And you would remember, many of you, about the significant strain on hospital resources. So the funding was provided to help kind of alleviate that burden on staff and beds in communities where capacity was close to max. And we also looked at communities where there was a high percentage of older adults, and an organizational readiness to provide programs and services that would support them. Another overarching goal was really showing that community and home supports are effective in helping older adults stay out of the hospital. So this was a wonderful opportunity to showcase the work of each of these organizations and the results of providing those supports, both to help older adults be more confident at home and help reduce those hospitalization events or re-hospitalization events. We did some data collection, and some of that was self-reported changes in health factors for older adults. So a key element of that work was looking to see measurable results and positive changes in self-reported factors. And what the impact was on daily living for seniors. And then we also gathered these organizations together through a community of practice. And so that was intentional in terms of bringing them together as a group to be able to co-design what those measurement factors would be, what those indicators would be, sharing some successes and challenges in that service provision. And, of course, an opportunity just to network with each other and really understand work that's happening in other areas of the province. And finally, we want to be able to communicate this great work with everybody. So that's the wider audience, all of you who have joined us today, other stakeholders, and really be able to share those great stories that say, hey, good work is happening in the community, and we want to be able to talk about those results with all of you and get a broader understanding. So that was sort of the overarching goals of those projects. And now we're going to dig into some questions with each other. So I'm going to start, I will start with you, Megan. And then I think we'll just go in the order that we introduced everybody at the start here. And our first question is, who was your organization trying to reach, and what were you aiming to achieve with this project?
All righty. So traditionally, the network would take individuals 50 or 65 and plus, but we expanded the age eligibility to 55 plus. In one of the reasons is to identify, we kept hearing that there's gaps in services, and so we wanted to kind of understand what those gaps were, and also to align with the other provincial projects, we chose to expand to 55 plus. Our clients would be any individual who's using the healthcare system for an issue or who has concerns that could be addressed in the community. And then they would have to be referred by a healthcare professional. So then that was another goal that we had, was to build strong relationships within the healthcare system and strong referral pathways from those systems into our program. So that included the acute care sites here in Calgary, so the hospitals and the primary care networks majority, oh, I can't even speak what that word is, but those were the two main areas that we focused on to get the referral pathways built. And the goal of that was to show the value of the community supports and to raise our profile in the healthcare system, and so that they could refer to us so that we can help reduce that healthcare strain. Thoughts?
Great, thanks, Megan. And Carrie.
Hi again. So our program was a little bit different. We were trying to reach all of the folks living rurally in our community. We cover such a big area, and we knew that there was folks needing these non-medical supports to stay in home in their specific community versus having to uproot their lives and come to the urban center. We worked really hard to echo what Megan said, building pathways with healthcare and trying to ensure the services already set up and the people already connected with the folks we were trying to serve had our information, and we were available to help as folks needed. Yeah.
Thanks, Terry. And how about you, Tatiana?
So our population that we were trying to reach was very similar to what Megan was describing. We were trying to reach older adults who presented in healthcare system with non-medical needs, and mostly individuals who have been discharged from the hospital and they were ready to go home. That was the original group of people that we were going to work with, and also older adults who are 65 plus. We also extended our age group to 55 plus, identifying the same needs as Megan, identifying the same gap as Megan mentioned. And eventually we also broaden our criteria to people who were able to self-refer to the program as well, not only working on preventing readmission to the hospitals, but also preventing admission. So those who were at risk of being hospitalized due to both medical and non-medical needs. So we were really hoping to decrease the number of readmissions and admissions for those people in risk.
Great, thank you for sharing that. And Krista, how about you?
Perfect. And working kind of in with Tatiana in the Edmonton project, she talked a little bit about who we were trying to reach, but also I think we were aiming to achieve with the project being a part of a provincial community of practice and having a standardized data collection and shared learnings with other projects that were happening across different regions, and really just working to collaborate with our health partners to identify seniors in need and to provide that seamless integration of care. So I think those were two additional aiming points of achievement for this project.
Great, thanks everybody. Yeah, and I hope all of you attending and listening today are starting to understand a bit of the flavor that was happening in each of these communities. So we will jump into our next question. And this is a broad one, so please speak to the experiences of each of your own work. But what outcomes did you achieve throughout the lifespan of the project? And we'll mix it up a bit. We'll start with Terry and then go in the same order. Thank you.
So, our outcomes, we were able to build really great relationships in each of the rural communities we were in with the already established senior service, or the community-based senior services already in each community. We were able to connect with a lot of older adults in each community and identify in those areas what they needed. We were able to bring a lot of services to folks in those communities. We increased our knowledge about and awareness about what those communities had to offer and what we could offer. So we worked really hard on relationship building, and that was a really great outcome, as well as the awareness piece. It took us a long time to kind of build some momentum because we were in so many different communities, but once we did, folks started catching on and reaching out to us, as well as the healthcare. That was a challenge, but we rose to that challenge, and now we have some really great relationships with healthcare, and we're working together a lot more on folks that are ending up in our rural centers needing those supports.
Great, thanks, Terry. And when we get to our Q&A section, for those health folks that are joining us today, have a bit of opportunity to provide some reflections on what those relationships are doing for your own work. So we'll move to Tatiana next.
I will echo to what Terry was saying. One of the greatest outcomes for sure was creation of the partnership with both healthcare providers and with community partners. So we were really able to create clear pathways for referrals from mostly hospitals and the home care system to the community, and also build this network of community partners working on those cases. From the client's perspective, from the practical support, we were able to help more than 115 individuals just in Jewish Family Services. I'm not counting even other organizations in Edmonton who were involved in this project. And the practical supports were very broad, and the cases were very complex, and some of those individuals are still remaining our clients, moving to a different project. And this also the great one of the great outcomes of this project was also that it created such a solid foundation for social prescribing project that we're working on. So that was really helpful.
Thank you, Tatiana. Krista, how about yourself?
Yeah, I think just to kind of echo what Tatiana had said, that really that development of strong relationships, especially here in Edmonton within home care, just recognizing that about 39% of our intakes within Edmonton from aging and community came directly from home care. So a huge relationship building with our healthcare partners. I think one of the other major outcomes that was successful in this project was actually seeing a reduction of both hospitalizations and emergency room visits for the clients within the project. I think that was one of the things we were aiming to achieve, and successfully were able to showcase that in the evaluation component. Really being able to support clients to access supports they needed, such as food security, transportation, psychosocial supports, housekeeping, and accessing financial supports were some of the benefits that we saw come out of the project, as well as just, and through that kind of evaluation component was actually improved self-reporting measures for both physical and mental health in the clients throughout the project.
Excellent, great. Thanks, Krista. And some of those achievements were seen were seen by everybody. So it's wonderful. Thanks for sharing. And Megan, how about yourself?
So like Tatiana and Terry said, we saw a strengthening of our referral sources. So with the majority of our referrals coming from the acute care sites and the PCN, so a little bit different than Edmonton where they had home care, but we had our hospitals and PCN. So we had 174 referrals, and of those, 138 came from acute care and PCNs. We continue to support these referral pathways with annual presentations and consultation with frontline staff. And we're looking at expanding our referral pathways to other areas of the healthcare system. In regards to our clients, all the data was self-reported from the client's perspective. So we found that there was an increase in confidence for clients living at home, and an increase in positive mental health and physical health. And then in regards to the healthcare system, our client self-reported data showed that there was a decline in emergency room visits and hospitalizations, which I think was across the board, which was really encouraging.
Awesome. Great. Thanks, Megan. I know, working with each of these sites at Healthy Aging Alberta was certainly, we learned along the way alongside them. And the results, I think, kind of speak for themselves, but happy to see it in the context of the stories that each of you are sharing today. So that leads us to our third question. So I'm sure everyone knows projects never go totally smoothly. Sometimes there are some hiccups and some learnings along the way. So let's talk about some challenges that you encountered that provided you with learnings. And we will start with Tatiana, please.
Well, probably the initial kind of challenge and learning experience in this project was the fact that we realized that building trust and relationships, especially with new partners, takes time. So it took us quite a few months to build this initial foundation for trust and the relationships with the healthcare system and with other community partners. So that was a challenge in terms of initiating the referrals to the project, but also a very great learning experience, which we appreciated in the end. Also, it was challenging, but again, contributed to learning to realize that there is a certain group of older adults who are very vulnerable and don't have many resources. Those who are younger, 65, the group between 55 and 65, we realized that this group is very vulnerable because there are not many benefits available in Alberta for that particular group of older adults. And we had to work very creatively on being able to assist those clients. So those probably the two major learning / challenges challenging experience that I can identify right now.
Thanks, Tatiana. And those are pretty big ones, so good opportunities throughout the work. So Krista, how about yourself?
Yeah, I think one of the other things we learned is that there's really an opportunity to learn from one another. The projects across the border were facing fairly similar challenges in the clients that we were working with, and so being able to kind of identify what those challenges were and work together and learn from what our other partners in other regions were doing to help assist through those additional needs. So I think that was one of the learnings that really came out, is that support that we received from the community of practice, as well as our partners across the different regional projects. Another thing that I just wanted to flag that we really came out of the project was just a need for somebody to actually be that role in supporting, especially when you're working with that collaborative of having a network coordinator or a project manager to support that collaboration and provide that room to connect. So almost along that backbone of support to have somebody kind of helping partners to establish what those roles might look like, or just have the space for that collaboration, for conversation to happen. Just that it really helps support both from a communications level of the project as well as for an understanding of the project itself.
Excellent. Thanks, Krista. And Megan, how about yourself?
Yeah, so similar to Tatiana here in Calgary, we identified quickly that there was a big gap in the 55 to 65. And as a network, as traditionally as the Way In network, we were experts and we're very familiar with the 65 plus, all the benefits and everything that fits in that bucket of individuals. And so as a network, we had to really start developing an understanding of the resources available out there for 55 plus and where the gaps were. And that included housing, financial gaps, food security gaps, health gaps, like all of the whole bucket, the whole gamut we discovered. And then as well, a challenge for our team was the intensive case management. So we had a lot of complex situations. So whether that's eviction or just a complex health situation, and then on top of that, there's addiction or mental health added on. So with that, we discovered that there was a need for some additional training and some additional education for staff to kind of help staff kind of understand the situation and give them the tools to best address those frontline. And then we also started an internal kind of within our program, an internal community of practice, just because we saw the advantages of a provincial one. So this internal community of practice gives the frontline staff the space to share what's going on, to share their challenges and to support one another. And that also helps with developing resources and sharing what's working for clients as well. If a client doesn't fit, one of the advantages of the network is if it doesn't fit well with a worker at one agency, we can share that load. So find the right fit for the client.
Great. Thanks, Megan. And Terry, we'll swing to you.
Like I had mentioned when I was talking about our achievements, one of our challenges was connecting with everybody and healthcare and each community we were in. So we did a very good job. We were in every community. We attended all the events and all the meetings. And so that took time to get included in those meetings and have that space and get our information there. And we also had to overcome, because we were kind of a new service coming into new communities. So lots of the folks we were serving weren't very trustful. They wanted to go with who they've known. And so we had to build some trust there. And we did. It was slow, and that was again the staff attending all the events and attending all the activities and just getting our faces and our information in these communities. And another struggle we faced was we offer all these supports in Red Deer and we were bringing them rurally. So we had to set those supports up in every little rural pocket we were going to. So we were advertising and actively setting them up at the same time. So that created its own kind of challenges with doing that. But we did both kind of at the same time, and it was good. Yeah.
Great. Thanks, Terry. Yeah, I think one of the themes coming through this for sure was the trust building from different angles, right? For both the older adults you're serving and then this other stakeholders that you're working with. So thanks everybody for your thoughtful answers there. And we're actually going to move into our final question today. And we will start this with Krista. So how did this project, or how is this project helping inform your current or future work with older adults? And I know you alluded a bit to that a little bit earlier, but maybe just some other thoughts you have, Krista.
Yeah, I know here in Edmonton, the work that was done through the Aging in Community Project really set the next steps and the pathway for the social prescribing project that's happening here in Edmonton now. We took a lot of the learnings as well as the relationships that we had built both with healthcare providers and our partnership to now further those and expand those referral sources as well as our partnerships as we move into social prescribing. We were able to then also transfer clients who maybe were at the tail end of aging in community directly into social prescribing. So those clients were able to sustain that support across and still receive those supports as they transitioned into social prescribing from aging in community. One of the other things that we were successful here in Edmonton in receiving was some additional funding for social prescribing that really helped with that missing coordinator role in Edmonton. So being able to have a project manager for social prescribing, utilizing that learning that we had coming out of the aging in community project, we were also able to use that the knowledge that we learned in the aging in community project to help develop the staffing need for social prescribing. So taking a look at and recognizing those complexities and the amount of time these pathways took to develop as we kind of looked at our staffing to what we would need for successfully building a social prescribing project. We were able to utilize some of the learnings that came out of that. So I think really it's informed the work. It's also really helped us to better understand portions around evaluation needs and the ways we can improve upon evaluation metrics as we transition to social prescribing.
Wonderful. Thanks, Krista. We'll move to you, Megan.
Sure. So like Edmonton, the Aging and Community Supports Program here in Calgary has moved to the provincial social and prescribing something popped on my screen, social prescribing project. We are in alignment now with social prescribing, and all the clients that were in the in-home supports, the other provincial project, have now been transitioned into social prescribing. The relationships and stuff that we built and continue to build, we're committed to providing information and presentations and going out and maintaining those relationships with those referral pathways, as well as expanding into other areas of the healthcare system. And like Krista alluded, this program or this project highlighted the need to track client data specifically versus a lot of our data was aggregate. So it was all combined in, and we couldn't really see if client A actually had impact, but we saw their greater impact across the whole program. And then from a Calgary perspective, we wanted to do more of a strategic hiring. So to avoid burnout and turnover, we wanted to hire people who have that intensive case management experience and the complex case management experience. Because on the Way In network, that wasn't really our expertise. So hiring someone with that more complex case background. As well, we are developing kind of a training schedule for our staff. So providing that education and training opportunities to help kind of support them in this complex work. And then we share cases. So if a case isn't working for one agency, we can share it with the other networks, as I talked about before.
Oh, I was just muted there. Next, we'll have Terry. Thanks, Megan.
So our project supported what we already knew. We knew that we had a huge population of rural older adults not receiving services. So it really highlighted that we were able to provide a lot of supports to people who wouldn't have received those. So the outreach team we do have, that wasn't a part of the Healthy Aging Alberta, we absorbed the caseload into our own caseloads, and we've continued to provide those supports in our rural communities. We're continuing to attend all the events in every community and the meetings we're invited to. So we're still trying to really continue to be in our community and our rural communities as a support for the older folks, and we're really trying to maintain those relationships as we move forward.
Perfect. Thank you, Terry. And we will end with Tatiana.
Thanks, Marla. As I've already mentioned, and Krista was talking about the same thing, that Aging in Community did create a foundation for social prescription. And Megan also mentioned about this, that we moved from Aging in Community to social prescription. And now it feels like a very well-oiled machine, thanks to Aging in Community project. So that was it really helps with the current service of older adults through social prescription. Also, Megan mentioned the complexity of the cases and the strategic hiring. So capacity is an issue because we do continue serving clients with complex needs. We did receive them through Aging in Community, and we continue receiving the same very similar referrals through social prescription. So Aging in Community sort of helped the frontline staff develop a collaborative approach to work on those cases in the environment when you lack capacity. You don't have enough case managers, but you still have a great team. And when you get together, you can brainstorm either internally within the agency or externally with other partner organizations, or even province-wide through community of practice meetings. So that's something that helped us to develop and maintain in that sort of collaborative work with every single challenging and complex case. We also focused more on the cases where the clients need home supports, including housekeeping and food security, transportation. The Aging in Community did show the big need in those resources, and since Jewish Family Services has this unique home support service that we offer, we keep developing and improving our services around that particular field of assistance to older adults.
Wonderful. Thanks, Tatiana. So that kind of wraps up a bit of the stories to each of the sites that were involved in this project. And that's really what we wanted to focus on in the discussion. I shared at the beginning that we will be also following up with an executive summary and a detailed report that does dig into some of those details a bit more. And of course, now we are opening Q&A and discussion, so we're happy to answer some of those questions as well now if you have them. One of the things that several of the panelists have talked about is social prescribing. And I wanted to kind of highlight that a bit today because I know we have a number of our health sector friends that are joining us and obviously curious, right, about how this project went, some of the results we've seen, etc. But you know, we also, the community likes to hear from your side as well. So I don't know if we have any brave souls out there today that would like to share a bit of feedback from their perspective in terms of impacts that you maybe are already seeing or are anticipating seeing in terms of your work with older adults and their non-medical needs. So if we have anybody from the health sector that would like to either share something in the chat or you're welcome to speak as well. So give that a couple of seconds here. I know we have some folks, so. Anyone brave enough to share? Okay. Now, if you're kind of gathering your thoughts, don't worry. You can raise your hand or share in the chat box as we carry on. I know in the span of this project, and any one of the panelists, please feel free to kind of add some extra thoughts too. But you know, you heard about some unique challenges from Terry in terms of reaching out into communities where they didn't already sort of have that established relationship, and the time and kind of trust that it takes to build those relationships, and then, you know, see referrals and kind of conversations going both ways. And here we do have somebody who's weighed in. Barb Panich, thank you. So Barb says, I work with the Seniors Lodge program and will be leading a review of that program shortly. Can you advise what you know of that program and if it provided any assistance as well? So Barb, I'm assuming you're talking about the Seniors Lodge program. I don't know if any of our panelists would have knowledge from the Lodge program. I think we have Terry and Tatiana are saying no. Megan, Krista, any knowledge? Yeah, our panelists do not have knowledge around that, Barb. I myself don't as well. I don't know if you have anything a little more specific. We'd be happy to kind of take something away too and help provide some information if that's helpful as well. Okay, and we have a question from Luana, wondering if any of the agencies providing services were able to get hard data from health regarding number of hospital, emergent care, doctor visits, pre-program, commencement, and then post-service delivery. So I don't know if any one of the panelists want to answer that now. I'm happy to jump in as well and provide some feedback too.
I just can speak to the Edmonton project. In terms of the Edmonton project itself, we weren't able to actually get any of that hard data. It was all based on client self-reports as to hospitalizations and emergency room visits. So no, not within this project, although we hope that that might be something that we could utilize in the future.
Yeah, and I'll add on to that. Some of the things we had to consider in the scope of this project was the timeline that we had. So we had 12 months, and that was a bit of a decision around as well how we collected the data, which we did in aggregate format for the span of this project. We do have some now work that's happening both in social prescribing and community and home supports, where we are collecting individual data. So we're able to tell that story a bit more fluently for individuals. Still not connected to health data though, Luana. So thanks for that question. And that would be a longer term goal of ours for sure, to see those two data sets of data kind of interconnecting and really telling the story. And we have a question from Jody. One question for any panel member. If you knew then what you know now, what suggestions would you make for community organizations when reaching out to the health system to build relationships? It's a great question. One of our panelists want to jump in there and provide their thoughts.
I think for me, I think you just have to start, and then you start with one person, and then you say, thank you for listening to my presentation. Do you think anyone else would value this? And then you start building your address book or your connections in the health system. And then I find that just snowballs, that people are excited about the programs and want to hear more, and they want their colleagues to know. So I find like being confident and asking for more connections is key, because health is just so big that you don't know who the right person is to ask. So starting with one and going from there.
That's great. Thanks, Megan. And I think we all know how many people are in the system and also how busy they are. So as in any sector, the more we're able to communicate, the better. Krista, do you want to
I think
add a
just
few
to
words?
add on to, just to add on to what Megan said, I think having really clear, consistent messaging as to what you're trying to communicate. As Marla said, we know that our healthcare partners are so busy in the work that they do. So having that clear, consistent messaging is really key when we're trying to reach out to healthcare providers, so that we're not sending mixed messages on what we're trying to convey, and that everybody has quick access to the information they need that encompasses everything about the program.
Thanks, Krista. So our next question from Christine: when a couple of panelists mentioned transitioning clients from in-home supports to social prescribing, was that referring to a new funding opportunity, or was that referring to a more programmatic approach? So correct me, panelists, if I'm wrong. I believe that was some additional funding that has come to both of those organizations. So being able to take that work and carry it forward with the new funding that was provided. And if there's anything else either of you, Megan or Krista, want to add. No, we're okay.
Yeah, it was additional new funding that was received from Healthy Aging Alberta and the Government of Alberta for the social prescribing project.
Awesome. Okay. So I'm just reading through the chat. I think we might be okay for question. Oh, we have one last one here from Luana. What was the most necessary or sought after home support requested from older adults? Now, I will say as a whole, it was food and meal delivery. So if each of you want to weigh in, was that the top for your particular site?
I think we saw a lot of the like in-home supports, like snow removal, housekeeping, yard care, that grouping, and food security, the meal deliveries, the access to healthy food was huge for us. And that kind of opened the door to more conversations on how else we could support the person and build that relationship. But if we've seen that typically that was the start, and then we were able to offer more services later on as folks bought into us a little bit more, maybe.
Thanks, Terry. Anybody else have any thoughts there? Tatiana.
I can add, yeah, just because, again, as I mentioned earlier, Jewish Family Services provides this unique home support assistance with housekeeping, meal preparation, transportation, supervision, etc. So many referrals were aiming towards those services. So this is why we ended up with a large number of the clients whose one of the main requests was for assisting them with in-home support, like housekeeping, meal preparation, grocery shopping, transportation, supervision, etc.
Wonderful. Thanks, Tatiana.
And I think to echo Terry, I think a lot of our clients came in maybe with the food security concern, but then they kind of fit into all the other categories as well. So I think a lot of our workers worked on housing, finding stable housing or affordable housing, and also the financial benefits. So finding financial resources to help kind of mitigate the crisis that the client came in.
Thanks, Megan. All right. Well, I appreciate everyone's questions, and we're just going to do a quick wrap up here. Okay. So thanks everyone for coming out today. We do appreciate your time. I know it's valuable, and each of our panels for sharing stories of your project work. We are going to follow up. And in that follow-up will be a survey. We would love it if you could take some time and just fill that out, because it helps us make sure that we continue to provide engaging events for you. Check us out on CORE if you haven't already. And we have another upcoming webinar on social prescribing. So if that topic kind of tickles your fancy, November 2nd at 10 a.m. Will be our next event. And there will be a link to register in that follow-up email that we're providing. And just as a reminder as well, we will be putting reports along with the recording of today's session on a CORE post following the event. So thank you everybody for coming out today. I hope you enjoy the rest of your day, and we really appreciate your time with us.
Thanks, Marla. I just wanted to end before everybody takes off. I think I can speak on behalf of all of the people involved in the project. We just want to say a huge thank you to Healthy Aging Alberta and to Marla for all of the work. I echo Amber's comments, just that we couldn't do it without you. So thank you very much.
Awesome. Well, ditto right back at you, all the community-based organizations throughout the province. Same thing. So take care, everyone. We'll stay connected, and we look forward to seeing you at the next event.